Hello, my name is Rafael DePillis, and I'll be presenting developmental achievement in Down syndrome based on the findings from a clinical cohort. For a little bit of background, Down syndrome is the most common cause of intellectual disability and is caused by the total or partial presence of an extra chromosome. The range of disability in Down syndrome has been observed to be very wide, but there is a lack of information regarding developmental trajectories for children. Here, I present findings meant to shed light on these trajectories based on survey responses from the parents of children born with Down syndrome, ages 2 months to 24 years, seen at our Boston Children's Down Syndrome Clinic. Our goal was to provide empirical data to establish developmental norms for this population, with the intended application as a tool for clinicians to identify children not developing as expected. Hopefully, this will increase the opportunity for early specialized intervention. Our data was collected from forms regarding development during routine clinic and physical therapy visits from March 2018 to March 2023. Sociodemographic information was collected through electronic medical records. We then analyzed this data by taking survey responses and categorizing them as true and false in regard to whether the child has reached a specific milestone at this time point. From the figure in the top left here, you can see survey responses as dots, with the answer choice on the y-axis and the age of the child on the x-axis. The response established skill was defined as true and the others as false. This data was then fed into a mixed effects logistic regression model, which mapped the probability of milestone achievement as a function of age. Here you can see an example logistic regression showing how a box plot can be created for each skill based on the skill development curve. The ages corresponding to 15, 30, 45, 60, 75, and 90% were mapped horizontally. Each box seen on the figure represents a regression similar to the one above and displays these probability points in relation to age found on the x-axis. Skills were organized by domain to allow comparison. To determine the probability of a skill being developed over time, one can look at the borders of each box color. For example, having a vocabulary of 11 or more words, signs, or pictures is 45% probable around the age of 2, 60% probable around the age of 5, 75% probable around the age of 9, and 90% probable just before 15. Our sample was composed of 853 individuals, being 75.1% male, 64.7% white, 7.4% Black/African American, and 2.5% Asian. The median age of a child at their first visit was 6.8 years, with an interquartile range of 2.2 to 11.4 years. To our knowledge, this is the first evidence-based milestones for children with Down syndrome across multiple domains, and it can be seen that there is a wide range of developmental functioning. Developmental delays were especially pronounced in the adaptive skills and in the receptive and expressive language. Having extended conversations remained challenging throughout adolescence. Some limitations of our study include surveys being susceptible to responder interpretation. Additionally, because our site receives referrals for more challenged individuals, these individuals may be overrepresented. Future directions will include a multi-site collaboration and comparing milestone achievement with and without coexisting medical conditions. Thank you very much for listening to my presentation, and please enjoy the conference.
Hi everyone, my name is Shannon Frizzell and I am the registered dietitian at the Down Syndrome Center of Western Pennsylvania. I'm really excited to be getting to present this poster to you all today and am going to be speaking a little bit about just some challenges that we faced in trying to implement a nutrition program in our adult center and some ways that we are actively working to try to overcome some of those challenges. I want to first start off by talking about why we thought it was so important to try and implement a nutrition program in our adult center. As many of us know, individuals with Down syndrome experience comorbidities, including sleep apnea, arthritis, and reflux, just to name a few, that can be exacerbated by excess weight. Obesity may also lead to decreased quality of life for patients with Down syndrome, including having a negative impact on community participation, independent living, and self-esteem. Just by highlighting these few points alone, it seems that incorporating medical nutrition therapy and increasing physical activity for this population should be standard of care. Unfortunately, there are a multitude of barriers limiting access to a registered dietitian for this population. And those barriers are going to be what I am going to be speaking with you all about today. One of the biggest challenges that we face in trying to implement nutrition services into our center is the limited, the limited amount of research that's out there related to nutrition and physical activity with regards to adults with Down syndrome. It's made it definitely challenging to, target certain interventions and to already know what works. At least to put a positive on this, we've really been able to use this as a learning experience and find out what works best for our patients. Kind of just to piggyback off of that point, another challenge that we've really been experiencing is just the lack of funding opportunities for nutrition programs that will benefit patients with Down syndrome. A lot of our potential funders have wanted us to be able to support what we're going to be doing with research and with studies, and since that information is so limited, that's been the challenge for sure. Also, a lot of our funders have wanted us to have more patients to include in the potential benefits of us implementing these nutrition services. And just since our adult population with Down syndrome is smaller compared to the general population, it's been a little challenging to secure that funding. Another challenge that we've faced is just a lack of nutrition professionals with experience working with individuals with Down syndrome. I can kind of speak just to my personal experience here. Going through a master's program in nutrition, we had very limited education opportunities to learn more about, patients with intellectual disabilities, specifically Down syndrome, and, common nutrition. I guess just common nutrition challenges that these individuals might face. Lastly, it's been challenging for us to be able to provide these services to our patients, as there is such inconsistency with insurance coverage for dietitian services. So we've really been working hard to try to secure those funding opportunities when they do come along, so that we can provide these services free of charge to our patients. Despite these challenges, we have been able to successfully offer nutrition services to our patients at our adult center over the past couple years now, and I just wanted to talk a little bit about some of the ways that we've been successful. We were able to secure some grant funding, so thank you to the Shadyside Hospital Foundation, and through them we've been able to start a program called Grooving Our Way to Health, where we've been able to provide one-on-one nutrition counseling to patients in our adult center, and also offering incentives like a Fitbit fitness tracker and a water bottle to kind of encourage participation in that program. We've also been successful with partnering with community organizations like our local Down Syndrome Association of Pittsburgh for me to have the opportunity to do free to the public nutrition education, like group classes. That's really kind of got us a little bit more support from other community partnerships as well. And lastly, we've been able to partner with our local universities to get students more involved, just to give me some extra assistance since our funding isn't always there. And it's been a really positive learning opportunity for our students as well. Overall, our patients have experienced a variety of positive health outcomes, and we're very hopeful that our results can be scalable to other centers.
Hello, everyone. My name is Will Graziani. I am a pre-med student currently graduated from Pennsylvania State University, and I've been working with Dr. Andrew McCormick, Dr. Mary Stevens, and Dr. George Capone to bring y'all this poster presentation. So what we have here is a literature review of the remaining unclaimed DSMIG treatment reviews. The unclaimed topics included in this literature review were GERD, dysphagia, type 2 diabetes, dyslipidemia, pneumonia, sinusitis, and rhinitis. Since these were the unclaimed topics, we were not expecting to find any sufficient data for the development of any real clinical applications. So really what we were trying to identify is to what extent are there gaps in the literature. Our design and methods were fairly standard. We excluded articles published before 1999 and included the filters human subjects, English language, and age greater than 18. Several key questions were also developed to inform the search strategy. Those key questions included: what are the available treatments for condition in adults with Down syndrome? What is standard treatment for condition in typical adults? Do the treatment options differ for adults with Down syndrome? What is the availability of treatment options for condition? Does treatment of condition impact morbidity or mortality of those individuals? And what are the financial costs, potential benefits, or harms of treatment? Of the 1,383 unfiltered hits, 2 met the inclusion criteria and at least answered one key question. We've broken it down into 2 tables, the first being the combined data of all the search terms excluding dysphagia, and the second being the data for dysphagia alone, which is where the 2 hits occurred. The Meyer article titled Management of Swallowing and Communication Difficulties in Down Syndrome, Survey of Speech Language Pathologists, answered the key questions: what treatment options are available for adults with Down syndrome, and what barriers are in place for treatment options. While the Henniken article titled Increasing the Number of Inter-Arch Contacts Improves Mastication in Adults with Down Syndrome, a prospective controlled trial, only answered the former key question. So, in conclusion, I'd say our findings were pretty much what we had expected them to be, maybe even a little more underwhelming than that, but it's obvious that alternative methodologies are necessary to address the gaps. We believe using a modified Delphi methodology to generate consensus recommendations based on the interest and expertise of DSMIG members is the way forward. We have included a graphic of the Delphi methodology on the poster. Thank you to everybody so much for attending. I hope we have been able to generate some interest, and have a wonderful day.